Good afternoon, everyone. Thank you for taking time out to be here with us. Before we start formally, I'd like to say my father and I and my family are very proud to call Goa a second home. We have been here since 2011, so we are one of the early movers and really appreciate the peace, tranquility, food, culture that the state has to offer and really enjoy our time here. So with that, I'd now like to take you through the presentation on our latest treatment. So at Dr. Batra's, we've always had a large hair practice and a lot of patients come to us for hair fall. In fact, I would say that we are the largest clinic for hair fall across India. We have 200 clinics in India, and we also operate clinics and have clinics in UAE, Bangladesh, Bahrain, and soon to open in one or two more geographies, which I can't disclose now, but in the process of opening another international center in another country very soon. Can you just put the presentation on, please, quickly? Thank you. So coming to hair, I'd just like to share, how I got involved in hair and my love for hair. Really, hair is my love and my passion. And in 2005, I went to London to study trichology. Trichology is the science of hair. Trich means hair, and logy is science. So I went to study the science of hair. Thank you. I'll let you know. That's the time I came across the different facets of hair. And what really intrigued me is the social aspect of hair. Because if you go back in time, long hair was always believed to be power and beauty. Even the judges in courts wore wigs to look powerful. Then what intrigued me was the emotional aspect of hair, because people who lose hair are very emotional about it, and they feel less beautiful and less handsome. They believe that they look older than their age, and studies also show that people who are balding have less sexual partners and also are less favorable for certain jobs such as sales and marketing. So the emotional and the psychological aspect of hair really plays an important role, and that's what got me interested. Even in our clinic, we see many patients who are coming for hair loss are actually concerned about the way they look, and especially in today's Instagram day and age, everybody wants to look good, everybody wants a good selfie. So it's become even more important and even more personal to them to have good hair. But what intrigued me the most was the medical aspect of hair, because by looking at hair, you can actually diagnose many underlying medical conditions. So you can diagnose manias by looking at certain types of hair. Mania is like a mental disorder. So there's a type of hair loss called trichotillomania, where patients pull out their hair and they eat it. It happens more in teenagers and more when they are stressed. You can diagnose PCOD, which is polycystic ovaries, by looking at a lady very often, because you see excessive hair growth and you see hair loss. You can diagnose thyroid, you can diagnose anemia. So hair tells a story of the inside of your body, and that's really what intrigued me the most. What also intrigued me was the medico-legal aspect of it, because there are certain things that you can test in the hair which do not remain traces in the human body. For example, drugs. Drugs have a life in the human body, but in the hair, your traces of drugs can last up to 9 months. So drug testing, physical abuse testing, murder, we learned all of that in our course, and that's what really intrigued me about hair. So now I'll take you through Exogen. We've been treating hair for the last 2 decades, and now we're bringing you the world's latest and best treatment, which is called Exogen, and I'll be sharing a little more on that. I've already shared with you my love and passion for hair and the story of what got me intrigued in hair. At Dr. Batra's, we've treated over close to 8 lakh patients, 7.8 lakh patients in all these years. My father started the company. I joined him in 2001. As I said, in 2005, I went to study trichology. And since then, we've really had a very effective hair practice, because we've always looked at bringing the latest and the best treatments for hair loss across the world into India. These are some of the common causes of hair loss in India. If you see, anemia is a very common cause of hair loss. Most women in India, a lot of women in India suffer from hair loss. Now, I've been a doctor since 2001, which is now about 13 years. And in those 23 years, what am I saying? Sorry, my math is a little weak, that's why I chose medicine. Okay, that's a joke, but 23 years. And my clinical belief and my clinical findings in my own practice are that about 30 to 40% of female patients in India lose hair because of low iron levels. Also, sometimes vegetarian diets aid to that. They don't supplement themselves well with B12 and anemia supplements, and that's why anemia is a very important cause of hair loss. Stress and lifestyle. I would add lifestyle here too. So stress, of course, is a very important cause of hair loss. Many different types of hair loss are caused by stress. There's alopecia areata, which is round patches where you lose hair in your patches, and all your hair from your head can just suddenly disappear and go very quickly. All your hair from your body, your eyebrows, eyelashes. I mentioned trichotillomania. Even male pattern baldness can be accentuated by stress. But let me talk a minute about lifestyle. Smoking, you see a lot of people smoking and vaping nowadays. That gives rise to your blood vessels, getting shrinking. And blood is a very important part of hair because hair grows and divides. The cells of hair divide and grow very quickly. So you need nutrition, you need good blood supply in order for your hair to be good. So lifestyle, smoking, diet. A lot of people diet on these fat diets nowadays. They want to be size zero. Again, they want to be Instagrammable. They want to show their weight loss journey. Losing weight is very important and very good, provided you do it the right way. If you do it in a very haphazard and abrupt and quick manner, without the right nutrition, you will lose hair because, like I said, hair is the fastest growing cells in the body. Chemotherapy patients lose hair when they go on chemotherapy for cancer. That is because the chemotherapy medicine attacks anything fast growing. And hair is a very fast growing cell. Therefore, naturally, if you diet or you don't have the right nutrition, your fast growing cells will suffer. Or if your blood supply to your hair is reduced, your fast growing cells will suffer and you will lose hair. Thyroid is a very important hormone. A lot of women, even men, lose hair because of thyroid. I would say this constitutes about 20% of hair loss. And PCOD. Studies in India show that polycystic ovaries, this is a women's problem. And studies show that 1 in 5 women in India today of a young age group have PCOD. And this gives rise to hair loss. This also gives rise to hair growth on the beard and on the arms for women. So it's very unpleasant. So these have been some of the common causes. Of course, the big one is the genetic hair loss, which is a very, very important cause. And until today, you could treat all of this. You had specific treatments for these causes, but nothing specific really for genetic hair loss. And now, till now, because we'll now discuss how genetic hair loss can be treated. Another statistic I'd like to share with you is young India is going bald. So India baldness is getting much younger. When I started my practice, you would see patients in their 40s coming for treatment. It then became late 30s, late 20s, and now it's early 20s and even late teens. So you find, a lot of younger people now losing hair very quickly. Like I mentioned, it's because of lifestyle, because of smoking, but also because of genetic hair loss. These are some studies that shows that, as I mentioned, the onset of pattern hair loss has now, the mean age is 21 years, which is very, very young. So as soon as you become an adult, you start to lose hair and start to look older. So adulthood now and turning 21 is not that much fun anymore. 50% of men suffer from male pattern baldness. So that's 1 in every 2 men in India. That's a very large statistic. And 22% of women suffer from female pattern hair loss. In women, there are many other causes like PCOD, thyroid, anemia. But in men, male pattern baldness is really the leading cause of hair loss. This is again a very interesting statistic across India. These are the year-on-year searches on Google because that gives you a trend. Which in 2020 was 6.4 lakh. In 2024, it's projected to be 22 lakh. So it's almost gone up like 400%. If you look at Goa, that's the Goa statistic. From close to 3,000, it's gone to close to 9,000. So 300% increase in the last 5 years on the searches for hair loss in Goa. So definitely, as we can see, these problems are becoming more rampant, more people are suffering, and they're also becoming younger. So what is the solution? Right? We've discussed the problem, and we've discussed that 1 in every 2nd man in India and 1 in every 5 or 4 or 5 women in India suffer from this type of pattern hair loss. But what is the solution? Let's find out.
यार मुझे ना अपने बाल कटाने नहीं चाहिए। काश मैं अपने बाल फिर से ग्लोबल।
Dr. Batra's है ना? Dr. Batra's लाए हैं एक्सोजन नैनो टारगेटेड हेयर ट्रीटमेंट जो इफेक्टिवली टारगेट करता है अफेक्टेड पैच ऑफ द स्कैल्प।
जहाँ बाल चाहिए वहीं पे डायरेक्ट टारगेट होगा ना?
बिल्कुल, यही तो है नैनो टारगेटिंग।
लेकिन हेरिडिटरी हेयर लॉस का क्या? उसका तो कोई सोल्यूशन नहीं है।
शायद एक्सोजन है वर्ल्ड का मोस्ट एडवांस्ड हेयर रीजनरेशन ट्रीटमेंट, एक्सट्रीमली इफेक्टिव इवन ऑन हेरिडिटरी हेयर लॉस।
हेयर लॉस का रीजन कोई भी हो?
हाँ, रीजन कोई भी हो, स्ट्रेस, हार्मोनल या हेरिडिटरी, एक्सपोजर का लेटेस्ट ट्रीटमेंट ही है सबका आंसर।
नो मोर वरीज फॉर हेयर लॉस, क्योंकि मैं हूँ। मेरा मतलब डॉक्टर बत्रा है ना। हेयर लॉस को फाइनली करेंगे बाय बाय।
So hair loss को करेंगे bye bye. That's what we hope to do with Exogen. We hope to treat all different types of hair loss, including hereditary, and give great results. So I'll just explain a little about what it does. So we've spoken about the fact that it's very effective for hereditary hair loss and really the first treatment for hereditary hair loss in the world. Second is it's a highly targeted treatment. Targeted treatment means that it actually goes to the area and it affects the area. So the hair growth happens from the dermal papilla of the hair follicle. So the exogen goes right there and attacks and treats the dermal papilla cells, so that there's no wastage of medicine in the middle. It's full of growth factors. It has 1,470 growth factors and peptides which are good for the hair, and mRNA. And these work targeted and they work precisely on the hair follicle. So again, this is a little bit of science about how it works. So the first is the release of exosome. Exosome is a molecule that is a messenger molecule that contains the medication, and that really is released. It then migrates to the targeted areas. Like I said earlier, all the medication was put on top of your scalp, and up till the time it would reach your hair follicle, there would be loss. Now it penetrates right and migrates up to the follicle and then starts working. It's targeted, so it finds the damaged cells and it latches onto them and revives them. So whatever hair cells are dying, it reactivates them. That's how it works. It then gets absorbed deeply into the dermal papilla of the hair follicle, and then it starts the repair and the healing process for the hair follicle. Just play this video, please. This is a testimonial of one of our patients who's taken the treatment very successfully.
I'm मैंने डॉक्टर बत्रा के साथ एक्सोजन हेयर ग्रोथ थेरेपी स्टार्ट किया और मैंने 3 सेशंस अभी तक किए हैं एंड इन 3 सेशन में मुझे ये बेनिफिट हुआ है कि मेरी जो हेयर फॉल है इट हैज़ रिड्यूस टू सम एक्सटेंट और मेरे स्कैल्प एरिया एंड ऑलमोस्ट दिस फोरहेड एरिया में मैंने बेबी हेयर ग्रोथ भी देखा है। I have experienced कि ये hair growth है, so I'm glad that this therapy is working with me. So thank you, Dr. Batra.
So there have been a lot of clinical trials conducted on this therapy. These are some of the patient benefits that we've got. You can see just after 4 sessions. So this is a South Korean treatment. Each sitting takes about 30 to 45 minutes. The sittings are every 15 days, so twice a month. So you can see in 4 sessions or 2 months, you can see how this patient's scalp has started getting filled out. Typically, the number of sessions recommended for treatment are anywhere between 10 to 20, depending on the extent of hair loss of the patient, the age of the patient. But you can see only in 4 sessions how this patient has got improvement. Again, here in 4 sessions, you can see the improvement. So these are wonderful results and improvement for anything to do with hair. No side effects at all, which is really a very strong aspect of this treatment. Any other treatment that's competitive in this industry and for this kind of hair loss involves needles, injections, pricking the scalp. This doesn't involve any of that. So it's painless, very easy to administer, very effective, and without any side effects. Again, you can see this patient here. So multiple patients and how, look at that, how the crown. So typically male pattern baldness, either the hair starts going from the front or you start getting baldness on the top. You can see how in these cases the patient's thickness and density is improved, volume of hair is improved, the hair counts have improved. So these are some wonderful results with this therapy of exogen. So that's it. So at Dr. Batra's, like I said, we are over 200 clinics. We have a success rate of 91% across all ailments we treat. We're the world's largest chain of homeopathy clinics and the world's largest website for homeopathy in terms of traffic and users coming to our website that engage with our site every month. We specialize in hair loss, skin disorders, respiratory, child health, women's health, weight management, diabetes, mental health, and a long list of other ailments that are very rare, where really, you don't have any specialties or doctors. A lot of those patients come to us for treatment for very rare conditions, where there maybe it's like 30 patients in the world, or 60 patients in the world, or just 100 patients in the world for those disorders. So that's it. We're happy to answer any questions that you may have. Thank you so much.
Lights.
Any questions? We are very happy to answer.
Dr. Sujat is said to be as a revolutionary innovation in the health care.
Yeah.
Can you explain what sets it apart from the other medical treatment?
The treatments, that how it's set apart.
Yeah.
Okay, so like I said, the first thing is that the technology of this treatment is very different because it is the only treatment that is targeted and precise for hair loss. So all other treatments that have been there in the past have not been targeted and not been precise. These treatments, when you apply on the scalp, they travel right up to the dermal papilla and then they start their action. So the first point is that there's no loss of medicine from application to the root of your hair, which is where all the hair growth takes place. So that's the first difference. The second difference is that it has 1,470 growth factors, which is the largest amount of growth factors. The next comparable treatment is something called PRP, which is plasma-rich platelets. If you know about that treatment, they take your blood out and they centrifuge it, remove the plasma, and then inject it back into your scalp. So apart from the pain of the process of injecting, taking out your blood, drawing your blood, centrifuging your plasma, injecting it back on your scalp, the plasma is from your blood, so it depends on your age and your health. In the best of health, you get 14 growth factors, 1/4 from your plasma. In the best of your health. So if you're a little older, the number of growth factors in your plasma reduces from 14 to 10 to 8 to 7 to 6, right? Whereas here there are 1,470. So it's like 100 times more effective in that sense. And clinical studies have also found that it's far more effective than any other treatment in the market for hair growth. So I hope that answers your question.
So how do you see the exogen transforming hair care?
Particularly where traditional treatments have limitations and everything. So how do you see this kind of this treatment, this transformation in the hair health care?
So I think I'll restrict it to hair care. And like I said, see, first thing is that till today there's been no treatment for hereditary hair loss. And hereditary hair loss is the largest segment of hair loss in India today. 50% of men in India suffer from hereditary hair loss. It's a very large number, right? Till today, there's been no specific treatment for that type of hair loss. So the first thing it's doing is giving an answer to a problem which is very large, which did not have an answer otherwise. That's point number one. Point number two is the ease of treatment, because today everybody wants ease of treatment as well. So where you have to do a hair transplant and remove roots and sit for an operation, or where you have to sit and take out your plasma and you have to then inject it into your scalp, the pain to a patient, the side effects from that are very large. So it's taking away the pain points of patients today. So it's addressing a very large problem. It's addressing it without any pain points. It's addressing it with great results. So definitely with these kind of treatments coming in into the market in India, I'm sure patients who otherwise did not want to undergo difficult procedures, did not want to undergo time-consuming procedures, did not want to wait very long to see their results, will now have a very good answer for their treatment. So that's how it's really going to change the industry.
So again, regarding the hair care or transplant, everything, it cost much more cost much for this. So is it affordable to the public, like the middle class people also?
So I'll give you the pricing. So the pricing for Exogen broadly works out to be 6,000 rupees a session. So that's what it broadly works out to be. Whereas a hair transplant can go up to 15 lakhs. There's a certain doctors who even charge that kind of money. Secondly, there is also a difference in the utility, because a hair transplant is best for where you have no hair. Where you have hair on the top of your head, you saw these patients, I'll just show you. If you see these kind of patients, if you do a hair transplant, you'll actually damage their hair because there's no bald spot really. You can see hair are there all over. So when you go to transplant a new hair, you make a hole, right? At that time, you will land up very often damaging the existing hair. So a hair transplant is good for the front when there's baldness on a receding hairline in the front. A hair transplant is not so good where you have diffuse thinning. So therefore, this is where again Exogen is different, because it can help you to get natural hair growth in these areas without causing any damage to you. So from a price perspective also, it is affordable.
Just one more question. When you showed the statistic from 2020 to 2024, it is rising like a danger sign for everyone.
Yeah.
What is the cause? Because from 20, what happened in 2020 to 2024? Because not many people are speaking about the vaccine also is cause of the health. So are there any studies? I don't know. This is a controversial question, but are there any studies that the vaccine causes hair loss?
So that's a very debatable question. I've not seen any studies which say that the vaccine has caused hair loss. There are a lot of patients who do report long COVID has caused a lot of hair loss. COVID and long COVID has caused a lot of hair loss. So long COVID is where you have COVID for an extended period of time. Very often people got COVID repeatedly also. So getting COVID and having hair loss, definitely there are clinical studies that correlate that. But I've not seen any study correlate the vaccine with anything else, because obviously I don't think that's something anybody wants to study, to be honest.
Because the statistics show that drastic thing has happened.
So I wouldn't say it's only related to COVID. I think a lot of it has to do with the lifestyle that people are following, which is why I said stress and lifestyle. Today, a lot of the young generation are not, their nutrition is very poor, right? They're ordering food from outside, the fast food, the cigarettes, the alcohol, the sleep cycles, the kind of products they're using on the hair, the gels they use on the hair, the chemical procedures they go through. You see so many children in school today who bleach their hair blonde and blue and red, and all this is actually, and the kind of gels they use to spike their hair, again for Instagram and to go out at night. So I think it's a lot to do with the lifestyle and the choices you make, along with, of course, having hereditary, having things like long COVID. I think all of this has contributed. I wouldn't give it one single contributing cause as of COVID or vaccine, but it's a multifactorial process.
Everything is multifactorial.
Yeah.
So when you're talking about this oxygen, is it something to do with oxygen? Is it anything to do
No,
with
it's exogen. Exogen, nothing to do
always
with oxygen. No.
Because a lot of people are, think that oxygen is the solution to all problems.
Oxygen is free and oxygen is great. So oxygen is a solution of this. We should breathe better. We should exercise better. We should have more trees, like we discussed 5 minutes before the conference. There should be more trees. I really appreciate the tree cover in Goa, and it should stay the way it is. I would love to see it stay the way it is and even grow. Oxygen is a great solution for life, but not for air.
So if you do this process, you're not going to take stress away from the person's life. So how long will it last?
That's a very good question actually. So our treatments are actually two-pronged. It's a very, very good question. One is the aesthetic side, which is exogen. And the second part of the treatment is very important, is homeopathy. So homeopathy is what really changes your response to that stress. So very often, in all cases actually, homeopathy and aesthetics are given together. And we're the only company in India that looks at it like that. Because while you're treating externally, you must also treat internally, so that the results remain for long. So we found with our combined treatments, our patients get excellent results. And the results last for long. Because these boost your hair growth. These bring about a very accelerated hair growth for you. And once you get that, then homeopathy works very well to maintain it.
And again, it will not fall. The hair will, the grown hair, which you have already grown the hair, that will not fall.
So
for that, what your treatment have to
Yeah, so again, that depends on your stressors and it depends on how regular you are with your treatment. If you're regular with your homeopathy and you take your exogen, your hair will not fall again, provided, of course, you're eating well and you're following simple basic rules.
Continue that treatment also.
No, you don't have to continue this treatment. You can take your treatment and you can stop this part, but the homeopathy you should continue because the homeopathy is what changes your reaction to stress. Also, studies have shown that homeopathy also works very well in pattern hair loss. It works very well in many different types of hair loss. It controls your stress, like Avtara said. So it really is a wonderful treatment as an ongoing supplement to these therapies.
So basically, you said this is the treatment, right? And there is a difference between treatment and transplant. So when I remove this, so the thing is, I started losing my hair, and there is a 22. I'm 33. So now, for a person like me, what you will suggest, treatment or transplant?
You're too far for me to see actually the hair follicles and all. For a person like you, I'd suggest stay cool and stay the way you are because I tell you, this is not a magical treatment for every case type of hair loss. This works for most hereditary hair loss, but what's very important is that there is a time that you need to come for treatment, right? If all your follicles are dead, then neither a transplant nor this treatment can help you. So in fact, in our clinics, because we're very honest with our patients in our assessment, so very important part of the treatment is the first 45-minute assessment that a doctor does with any patient who comes, understands their type of hair loss. There are 40 different types of hair loss. Looks at the hair follicle to see, whether how many are there. We do a little count. We see what is the quality of hair. Based on that assessment, we then tell you whether or not we can help you. And we actually every day turn away 15 to 20% of our patients, telling them that their type of hair loss or their stage, really, not the type but more the stage of hair loss. If they've lost all their hair and they've come for treatment, there's really nothing that can in the world today that can regenerate it. So our skin treatments are, we basically are into medical management of skin disorders. Most of our patients are for conditions like vitiligo, which is white patches where you start losing your discoloration, you start losing your skin color, and your pigments die, and therefore you start getting these white patches. Again, it's a very socially difficult problem because people find it very embarrassing, especially when it comes on exposed parts of the body, or psoriasis, which is a skin condition where your skin starts to flake faster than normal. A lot of acne patients, a lot of pigmentation cases, a lot of cases of lichen planus, so really more on the medical side. And again, we have aesthetic treatments there as well, where we combine homeopathy along with aesthetics to give the best results to our patients.
So what do you like to say about the
Scalp health? I think I can just give you some tips for good hair and scalp health, right? The first tip for good hair and scalp health is that use the right shampoo for your hair wash. Very important. You should try to find a shampoo that matches the pH balance of the scalp, because the pH balance of the scalp is 6.5, and any shampoo that is acidic or alkaline will eventually over a long time damage your hair. So you should find a shampoo that is has a pH balance which is natural, that matches that of the scalp. Our Dr. Batra shampoo has been made that way so that the pH balance of the scalp is matched by the shampoo, so it's neither acidic nor alkaline and doesn't damage your scalp or hair in any way. Number one. Number two is that I would say that avoid parlor procedures as much as possible, because straightening your hair, curling your hair, earlier though only women used to do it. Now they're using men also with long hair, straightening it, curling it, perming it, all different looks. So I would say try to avoid it as much as possible. If you're using a color, use an ammonia-free color. If you're drying your hair with a hair dryer, try and keep it on low heat, because the heat can also damage your hair and fray it. And the last tip is for good hair and good hair health, nutrition is very important. Because like I said, the hair follicles multiply very, very quickly, and they need, because they're dividing, they're multiplying and dividing very fast. For that division, they need blood supply, because blood supply carries the nutrition. So if your blood supply, say the blood vessels are shrinking, like it happens in this kind of hair loss, one of the things that Exogen does is it actually increases the blood flow to your hair follicle, so that the nutrition that you eat can actually go and affect your hair in the right way. So nutrition is very important. In nutrition, protein, iron is the two most important things. A good, healthy, balanced diet. Maybe if your B12 is low, then a supplement, or your iron is low, then a supplement is recommended. And these are the, and sleep and stress, of course, as we spoke about, that stress plays an important role. So if your sleep is where your body repairs and heals. So sleep is also where the energy that you're utilizing in your day is kept, reserved, and when you sleep, that's the energy that goes to really revitalize your body. So not just for skin, but even, not just for hair, but even for skin and general health, sleep becomes very important.
Shirshasana will help. Shirshasana, doing
Yes,
Shirshasana.
doing the headstand, I believe, has remarkable achievements.
Blood supply.
Does
Blood
it
supply.
improve?
I don't know. I don't know. There's no. It's difficult. Not everybody can do it. It's dangerous if you have high blood pressure. So only if you're an expert and you've been doing it. I can't recommend a patient to start Shirshasana if he's never done his life. I can't do it. So I can't recommend anybody else. But there are other ways to improve your blood circulation. Just with a light fingertip circular massage on your hair, which is far easier, without even any oil. Just light round rubbing just stimulates the blood flow to your hair. So that's a much easier way to do it. It's very important, yes. Soap should not be used on your hair. You should use a shampoo. Like I said, chemicals cause hair fall in multiple ways. One is the hair products that people use in the parlor, which really should be avoided as far as possible. The second is by using the wrong product on your hair while washing it, which is like you should not use a soap, you should be using a shampoo. Like I said earlier, the shampoo should have a pH balance that matches the pH balance of your scalp. And the third, very important, is aftercare or evening care, as I call it. Like when you're going out, you're putting gel very indiscriminately, using it a lot. There are natural variants like aloe vera. You can use aloe vera gel rather than a chemical gel. The more natural products you use, the better it is for your hair.
Using oil is good. Using oil is good or bad?
Using oil is good in some ways. Using oil nourishes your scalp. It keeps your scalp moist. But it's not really good. Oil doesn't really grow your hair. Oil doesn't take care of the medical conditions underlying which cause hair loss. So it's a good practice, but it's misinterpreted that if I oil my hair every day, my hair will be long and beautiful. That's not correct. Yes.
Dr. Batra's training, what are the courses you offer and what are the duration?
So Dr. Batra's Academy is actually one of the very few public-private partnerships in homeopathy health education. And we are tied up with the Maharashtra University of Health Sciences. We have two programs that are currently running with the MUHS. One program is the homeopathic dermatology program. That's a fellowship in homeopathic dermatology. There you can join the program either if you're an MD homeopath or if you've completed 10 years of homeopathic practice. And that program is a 1-year program. There's also a program in aesthetic dermatology, which is a 6-month program.
There's also an advanced homeopathy program. We also recently we are also starting an oncology program in homeopathy. So for cancer treatments and homeopathy, there's another program that's going to be started soon. And not just Mumbai University, but we've also now gone to Gujarat University. We've tied up with 2-3 deemed universities over there to actually start the same course, similar course in South Gujarat also.
You are not tied up with Goa University?
Not yet, but we'll be happy to anytime. We have to take one thing at a time now. We've been doing this for the last 5 years or so, and it's not easy because we have to follow all the academic conditions of the university. So it's...
Right now it is Bombay and Gujarat University.
And again, it is, sorry?
Right now it is Bombay
Yeah,
and Gujarat.
right now it is Mumbai and Gujarat University. Thank you. Thank you very much. We're happy to meet you informally. Thank you. And thank you, Akshay, for your time. Thank you. Lovely to see all of you here. Thank you again.